Hello and welcome to our channel. Today, we will be discussing ischemic heart disease. Ischemic heart disease, also known as coronary artery disease, is a condition that affects the blood flow to the heart. It is one of the leading causes of death worldwide. In this video, we will answer some of the most frequently asked questions about this condition. So, without further ado, let's get started. Ischemic heart disease occurs when the arteries that supply blood to the heart become narrowed or blocked, reducing blood flow to the heart muscle. This can lead to chest pain or discomfort, shortness of breath, and other symptoms. The most common cause of ischemic heart disease is the buildup of fatty deposits, called plaques, in the arteries. These plaques can eventually rupture, leading to the formation of blood clots that can completely block blood flow to the heart. Risk factors for ischemic heart disease include high blood pressure, high cholesterol, smoking, obesity, diabetes, and a family history of the condition. What are the risk factors for developing ischemic heart disease? As previously mentioned, the risk factors for ischemic heart disease include high blood pressure, high cholesterol, smoking, obesity, diabetes, and a family history of the condition. Other risk factors include a sedentary lifestyle, a diet high in saturated and trans fats, and stress. It is important to note that some risk factors, such as family history and age, cannot be controlled. However, there are steps you can take to lower your risk of developing the condition, such as eating a healthy diet, exercising regularly, not smoking, and managing chronic conditions like high blood pressure and diabetes. What are the symptoms of ischemic heart disease? The most common symptom of ischemic heart disease is angina, which is a type of chest pain or discomfort that occurs when the heart muscle does not receive enough oxygen-rich blood. This pain may feel like a pressure or squeezing sensation in the chest and can sometimes spread to the arms, neck, jaw, or back. Other symptoms of ischemic heart disease include shortness of breath, fatigue, nausea, and lightheadedness. In some cases, ischemic heart disease may cause no symptoms at all, which is why it is often referred to as a silent condition. How is ischemic heart disease diagnosed? To diagnose ischemic heart disease, your doctor may perform a physical exam and order tests such as an electrocardiogram, ECG, a stress test, an echocardiogram, or a coronary angiogram. These tests can help detect any abnormalities in your heart structure or function and determine the extent of blockages in your arteries. Your doctor may also recommend blood tests to check for high cholesterol or other risk factors. What are the treatment options for ischemic heart disease? There are several treatment options available for ischemic heart disease, depending on the severity of the condition. Lifestyle changes, such as quitting smoking, eating a healthy diet, and exercising regularly, can help improve blood flow and reduce the risk of complications. Medications, such as aspirin, beta blockers, and nitroglycerin, can help manage symptoms and prevent blood clots from forming. In some cases, surgical procedures may be necessary to improve blood flow to the heart. These procedures may include coronary artery bypass surgery, angioplasty, or stenting. Can lifestyle changes help prevent ischemic heart disease? Yes, making lifestyle changes can be an effective way to prevent ischemic heart disease. Eating a healthy diet that is low in saturated and trans fats, maintaining a healthy weight, and getting regular exercise can help reduce the risk of developing the condition. It is also important to avoid smoking and limit alcohol consumption. By making these changes, you can help improve your overall cardiovascular health and reduce the risk of developing other chronic conditions, such as high blood pressure and diabetes. Is ischemic heart disease the same as a heart attack? No, ischemic heart disease is not the same as a heart attack. Ischemic heart disease refers to the narrowing or blockage of the arteries that supply blood to the heart, while a heart attack occurs when one or more of these arteries become completely blocked, cutting off blood flow to the heart muscle. While ischemic heart disease can increase the risk of a heart attack, it is possible to have ischemic heart disease without ever having a heart attack. Can ischemic heart disease be cured? There is no cure for ischemic heart disease, but it can be managed effectively with lifestyle changes, medications, and, in some cases, surgical procedures. By making these changes and following your doctor's recommendations, you can help slow the progression of the disease and reduce the risk of complications. What is the long-term outlook for someone with ischemic heart disease? The long-term outlook for someone with ischemic heart disease depends on a variety of factors, including the severity of the condition, the extent of any blockages, and the effectiveness of treatment. With proper management and lifestyle changes, Many people with ischemic heart disease are able to lead active, healthy lives. However, it is important to continue monitoring the condition and following your doctor's recommendations to reduce the risk of complications. What are the complications of ischemic heart disease? If left untreated, ischemic heart disease can lead to a number of complications, including heart attack, heart failure, and arrhythmias, irregular heartbeats. In some cases, it may also lead to sudden cardiac arrest, which is a life-threatening condition that requires immediate medical attention. That is why it is important to seek medical attention if you experience any symptoms of ischemic heart disease, such as chest pain or shortness of breath. That concludes our discussion about ischemic heart disease. We hope that you found this video informative and helpful. If you have any questions or concerns, please don't hesitate to leave a comment below. And if you enjoyed this video, please give it a thumbs up and consider subscribing to our channel for more health-related content. Thank you for watching.